Warning, this video will have mild coarse language and may include uncomfortable and confronting content, mostly about your guts and your butt. Viewer discretion is advised. Colonoscopies are vital and life-saving procedures. A colonoscopy is a medical exam that allows evaluation of the large intestine, known as the colon. While colonoscopies can be utilised for cases involving blood in the stool or abdominal pain, they're more commonly used in screening programs designed to detect colon cancer. An upcoming contender against the traditional method is virtual or CT colonoscopy, which uses CT imaging to view the colon. There are pros and cons for both procedures, but is one better than the other overall? Let's find out. First off, let's talk about bowel preparation. Before a colonoscopy, a clean and empty bowel is key to achieving the best visualization of the colon. As such, patient compliance is vital in the preparation process. And we don't really want anything clogging up the scope either. Doctors generally prescribe bowel preparation kits like Glycoprep C or PicoPrep. Polyethylene glycol or PEG is the osmotic laxative present in Glycoprep C, which induces diarrhea. Its isoosmotic nature, due to included electrolytes, helps to prevent dehydration and is also easy to administer and can be taken in split doses. On the downside, however, typically 2 to 4 litres needs to be taken. This high volume and its unpleasant taste are the major disadvantages. The large amount of fluid consumption can cause nausea, headaches, or vomiting, and is often a difficult task for most adults. A low-fibre diet 2 days before the exam and a clear liquid diet the day before the exam is also recommended. Full bowel cleansing is still required in CT colonoscopy. However, recent investigations of a prepless method without the use of strong laxatives is technically feasible and safer for elderly patients as the risk of dehydration is reduced. This is done by fecal tagging of the stool, in which barium acts as a contrasting agent to distinguish residual stool from polyps in the CT image. The greatest advantage of this prep is the reduced burden of consuming large amounts of fluid, ultimately leading to greater patient compliance. Unlike most other procedures in a surgical setting, the patient must undergo anesthesia or sedation during traditional colonoscopy. However, it is not required for CT colonoscopy, which involves a computed tomography machine in which a patient will be placed in prone and supine positions. During a traditional colonoscopy, a long flexible tube will be inserted into the rectum, with a camera and light source at one end, which will give a live video feed of the colon, just like a YouTube video. CT colonoscopy, however, is a lot less invasive, with only a small catheter placed into the rectum, insufflating carbon dioxide to expand the inside wall of the colon in order to get a clear view on the CT image. Traditional exams usually take no more than 30 minutes, while the entire CT colonoscopy takes less than 20 minutes, with 2 10-second breath holds. Downtime is needed after a traditional colonoscopy, as the patient needs to recover from the sedation. However, no recovery time is needed after CT colonoscopies. Traditional colonoscopies have a longer follow-up interval than CT colonoscopies. Screening continues every 10 years for traditional and every 5 years for CT colonoscopies. CT colonoscopies compare well to traditional in the detection of polyps. However, sensitivity and specificity values vary between studies. Traditional exams can provide a clear, real-time view of the direct tissue and are able to perform biopsies, which can provide greater information about irregular tissue. Traditional colonoscopies are more operator dependent, which could lead to variability in accuracy of the test, including estimation of polyp size, which is also subject to the examiner. However, in CT colonoscopy, polyps can be measured using an electronic ruler, increasing the accuracy. CT colonoscopies can be useful in finding polyps that are hidden behind folds, which are occasionally missed in traditional colonoscopies, and can produce 2D and 3D endoluminal views of the colon, boosting diagnostic significance. Results from a large multi-center trial have confirmed its relatively low sensitivity for polyps, less than or equal to 5 mm, but was substantially more effective with 90% sensitivity for large polyps, more than or equal to 10 mm. Despite these benefits, CT colonoscopies are vulnerable to artifacts. Incomplete cleansing with the prepless method may make it more challenging to identify any polyps. However, electronic cleansing can remove residual feces from the colon image. CT colonoscopies also allow assessment of the abdomen, where extracolonic findings may be clinically relevant. Both procedures have their fair share of complications. Investigations have shown that perforation occurs at a rate of just 0.02 to 0.08% in CT colonoscopies, but up to 0.2% in conventional colonoscopies, which is significantly higher due to its invasive nature. Major bleeding from biopsy and perforation are the most feared complications with the conventional method, which can lead to incomplete procedures. The high pressure during insufflation is a common cause of perforation in CT colonoscopies, but is considered safer than a mechanical scope. Adverse reactions to sedation is uncommon, but there is concern in patients with severe heart or lung disease. CT colonoscopy is able to avoid cardiopulmonary risks as sedation isn't used. There are also raised concerns about the possible effects of radiation in CT colonoscopies, but a recent study proclaims that its ability to detect polyps far outweigh any risks for most individuals. Identifying extracolonic findings may also cause undue anxiety, unnecessary costs of additional testing, and extra exposure to radiation. Both procedures have levels of Medicare and private health insurance coverage and consist of comparable procedure costs. However, this may vary with further testing, biopsies, and increasing expenses, including bowel preparation kits, which may need to be purchased from a pharmacy. Due to CT colonoscopy's current popularity with patients, its future in the medical imaging industry is looking bright. Studies have proved its comparable, if not higher, sensitivity rate to gold standard procedures like traditional colonoscopies or barium enemas. Given this, in March 2008, CT colonoscopies were added as a screening test in the American Screening Guidelines to test average risk patients aged 50 and above every 5 years. Current studies have also revealed its practicality in constructing virtual colons as staging and treatment models for endometriosis. Ultimately, it's hard to say whether one procedure overrides the other, as both have promising qualities. But all in all, the greatest advantage of CT colonoscopy is its minimally invasive nature, which helps to alleviate the scarce acceptability or fear by the general public for traditional colonoscopy, proving itself to be a fantastic alternative for colorectal cancer screening.